Hello, I'm Carol Amos. I'm a GP in Powys, in Mid Powys, in Mid Wales, but also I'm very much involved in encouraging school students to think about medicine as a career. And my son, who's here with us today, is also a medical student in Cardiff. But I want to ask some questions, partly because in lockdown it's been very difficult for school students, I know, to get lots of information about medical schools, so we thought that this might be helpful to get a personal insight into what medicine has been like for Hallam.
Yep, so I'm Hallam. I'm in my fourth year at Cardiff University. I've been here, I started in 2013, straight out of school, 18, and I intercalated last year in neuroscience as well. I'm in my fourth year of medical school.
So what would you say is the most usual course for the medical student through the medical curriculum, the medical course?
Yep, so 2/3 of students do 5 years, often straight after school, but plenty do it postgraduate or have a gap year, or there's lots of different ages and people joining at different times. So 2/3 go 5 years straight through, and a third intercalate, which means you do another degree for just 1 year in the middle, so that takes 6 years. So yeah, it's split roughly 2/3 who go 5 year course and a third who do 6 year course. Yeah, so people who intercalate, which I say is about a third of students, some do it after third year, some do it after fourth year. People generally undertake it in science-based degrees. So I lived in a house with 7 other medics, and there was a mix of some of them did anatomy, some did pharmacology, some did psychology. I did neuroscience. So generally it's in science things, but you can do other things. A lot do medical education. So it's just a year. You go into more detail in something. Often there's a dissertation where you can do a longer project in something you're interested in. You can't elongate it at that stage, but if you're interested in research, you can go and do a PhD after your medical school studies, or a master's. There's quite nice gaps after you finish training as well. It's not necessary to be a doctor. As I say, 2/3 don't do it, and a lot of what you learn isn't directly applicable to when you're an actual practicing doctor, but it's more for interest and to get a bit into research if you think you might do that longer term. Funding wise, it shouldn't be too much of an issue, because after you've done 4 years, you get an NHS bursary to cover your tuition fees, and you get a bit extra. I think it's £1,000 a year for accommodation and stuff. So if you intercalate, you get that for 2 years. If you don't intercalate, you only get that for your final year. But it's so that shouldn't stop you from doing it. But yeah, if you want to intercalate, you have to generally be in the top third of the year academically in your first 3 years, because it is challenging, because you go into a 3 year course with the final year students, and you have to kind of catch up on their first 2 years of learning, because you've only got 1 year to cover the whole curriculum basically.
Would you say it was of value to do it? What did you gain from it?
I loved it. I think it's really good. It's good to have on my CV. So if you're going for something competitive like surgery, it's good to have, because it sets you apart a bit. I wouldn't have said it's particularly useful directly what you learn. A lot of it's very niche science that you won't really need as a doctor, but that was my experience in neuroscience. I think there'd be some that maybe there would be more use to it, but you don't need it, and because a lot of students don't do it, it'd be never something that's required. Some universities is, though. I think a lot of the London universities and Oxford and Cambridge, everyone does a degree in the middle there, but yeah, not in Cardiff.
Are you pleased you did yours though?
Yeah, definitely. I really enjoyed mine. I'd definitely do it again. And if I was saying to someone, if there's anything they're even slightly interested in, I reckon it's a useful year just to break up the medical school cycle a bit.
Okay, so thank you. So when and at what age do most medical students become a doctor? Does that mean that they're unable to see patients on their own? And at what stage of the medical course would you say you become a completely independent doctor?
So most people, if they go straight from school and do a 5 year course, would gain the doctor title at about 23, but it varies massively. So I had friends who came post-grad, so they won't finish until they're 28, 29. There are some who do it even later than that, worked other jobs and then come into medical school late. So there's a whole range of ages and nationalities in there. So yeah, but the most common is probably by your mid-20s. you see patients from the first year. So the first couple of years, it's maybe once a week you spend in hospital or GP surgeries, just getting used to clinical placements. But from third year on, the majority of teaching's on placement in hospitals or GP surgeries. So the years generally run, you have a week of lectures and then 8 weeks of placement, and that just cycles. So that's brilliant because it means you get to see patients and actually put some of what you've learned into practice. But even when you're fully qualified as a doctor, you're never completely independent. You're always learning. That's one of the great things about it, and that you become a doctor, but your foundation years where you still cycle through lots of stuff, you get a lot of variety, and then even then you've got a lot of training afterwards, which can go on for years and years. And I think even when you're a consultant, you still have to make sure your knowledge is up to scratch, etc. So I'm not sure you're ever done learning, which is one of the things about it.
Definitely, as a GP, I find it's great that you forever sort of keep learning, keep sort of reading and finding out new things, which is one of the brilliant challenges of being a doctor, really. Okay. So it looks like the sun's got it, but can you please just briefly outline what happens after you become a qualified doctor and stages after that for different specialities? Because I know a lot of school students are quite keen to know the progression of medicine.
So after your 5 or 6 years usually of medical school, you have F1, F2, your foundation years, where you rotate through different specialities. So it's 6 4-month rotations, of which one's usually a core medical job and one's a surgical job. And then of the remaining 4, one's usually out in the community. So that's GP, so that's 2 years. Then after that, there's quite a natural break. So a lot of people go travelling at this point, or go to work in Australia, where you can work without any further qualifications. Just kind of have a bit of a break, because a lot of people have been in education for a long time up to that point. And then after that is when you specialise. So, for example, at the moment, if you wanted to be a GP, that's a further 3 years of training, of which a year or 18 months is in the hospital, and then another either 2 years or 18 months is in GP practice. Or if you want to do something like neurosurgery, it would be up to kind of 10 or 11 more years of that after training before you can apply for consultant posts.
At what stage do you need to decide what you're going to specialise in?
Well, a lot of people don't decide until they're applying for jobs, really. But it's often good to decide as early as you can, because then you can kind of direct maybe research projects, or there's part of the course in every year where you choose a project to do at the end of the year. So if you think you like something quite early on in the course, then you can choose to do or try and find a research project with a doctor in that field, which is always useful. But unless you go into something competitive, I don't think you really need to decide until right before you apply, really. So that's a couple of years after the end of medical school. So I think it's good to go in with an open mind and see what you enjoy as you go along, and then work out parts of fields that you enjoy, parts that you don't enjoy, and then I think by the end most people have a pretty good idea of an area they want to go into.
So what experience do you have of different specialities through the medical course?
Yeah, so the first 2 years you learn about, in theory you learn about every different part of medicine, and then you revisit it in your clinical years. So you'll have, say, a couple of weeks in neurology, a couple of weeks in psychiatry, 4 weeks in obstetrics. So you get clinical placements in all of them to see what you enjoy, actually on the job. And then again, as I said earlier, in F1, F2, you get a chance to do them for real. As a doctor, 6 of ones that maybe you think you might be interested in.
Would you, if you start embarking on a speciality, can you change your mind?
Yeah, a lot do. Loads of people start in one and move into another. Because obviously priorities change. When you're younger, maybe you want something that's really exciting, and you can save lives, as it were, every day. But then people's priorities change, and they have children or want a better work-life balance. So yeah, a lot of people change even once they've done a few years in a training post.
Absolutely. So back to school. When did you decide to do medicine, and why?
Well, both my parents are doctors, so that was an easy lead in, I guess. You both enjoy your jobs, and that was definitely something I looked at. I think initially it put me off when I didn't really think about it, but when I got to about 14, 15 and I was deciding on my levels, that's when I thought, yeah, it was something I'd like to do. So for me, I was 14, 15, which I think would probably be what most people have to decide, because you're sort of a little bit limited in what A levels you have to do. Most medical schools would ask for chemistry and probably biology and maybe another science as well. So sort of before you choose your A levels, you have to kind of settle on it.
Okay. So what do you think are the most important attributes to becoming a doctor?
I think empathy is key. You have to put yourself in the patient's shoes and recognise where they're coming from, really listen to them, have good communication skills, which is something that's really emphasised throughout the university degree. You have to be able to talk and listen to your patients really well and be able to understand what they're trying to get, especially if they don't have maybe the knowledge of intricate pathologies or whatever. I think it's important to keep an open mind. You've always got to be learning, always adapting as medicine is constantly evolving. You've got to be able to keep up the course. You've got to be inquisitive. I think an innate want to help people is useful, because that's what you're going to be doing. And when you're working in the middle of the night, if you're doing it for egotistical reasons or whatever, then you're not going to want to be there and you'll give up. So I think it's useful to have that want to help people, be inquisitive, be interested in science, because there is a lot of it. There are some jobs that don't, but a lot of jobs you have to work within a team. So being happy working with people and being good at teamwork is useful as well.
Okay, so how as a school student do you think, or how did you show that when you were at school, so that for your interviews or your personal statement you could show some of these attributes?
I think getting good grades is number one. If you're strong academically, you're more likely to get an interview. So that's number one. Try and focus on studies, and then all extracurricular activities can kind of show these different aspects in different ways. So if you play sports, it shows you can work in a team. You're willing to commit to something. Same with musical instrument or a variety of things. It shows commitment, which I think they're looking for. I think an awareness of what's going on in the news, especially advancements in medicine and stuff, is useful because it shows that you're interested in the field and you're committed to it. I know a lot of people talk about kind of getting work experience, which is important, but obviously not possible for some people. I was lucky with you guys, but some people aren't as lucky. But even if you're working in a charity shop or something, it shows commitment and a willingness to help people that I think that interviewers would look favourably upon.
Absolutely. Communication, how can you show as a school student communication skills?
I don't know, volunteering in maybe junior schools. I know that's what I did. I don't know.
Again, working in charity shops, anything where you're dealing with other people, and then even at interview or anything, being able to describe the people that you see and show real interest in other people is a great way to show, really, isn't it? Okay. The other thing, I guess, would be sort of positions of responsibility within school.
Yeah, definitely.
Is obviously a way of showing leadership, but also communication with others and teamwork. So why did you choose Cardiff? And regarding Cardiff, can you describe the course and a bit about the mix of lectures versus other type learning that you have at Cardiff?
Yeah, so Cardiff is obviously close to where I grew up. The city's great. I was sort of committed to staying in Wales, so that's why I came to Cardiff. But it's been brilliant. I've loved the course there. I thoroughly recommend it to anyone. At Cardiff, it's maybe more of a PBL, I don't know if that term's still used, but that was what was.
What does PBL stand for?
So problem-based learning. At Cardiff, it's called CBL, so case-based learning, but where you have some lectures and then you have a sort of case that oversees it all. You work in groups to kind of research yourself, I guess, or within the group, different aspects of it. So you've got pathology, you've got histology, pharmacology, all related to the overseeing case, and that will cycle every 2 weeks. So that's how it works at Cardiff. I know other universities are far more lecture-based, which works for some people. I think when I was going into it, I thought that would suit me more, but now I've done the kind of more PBL type course, I think that's much better, just because it's more interesting and makes it more relevant than just learning facts off a computer screen. And then from the third year onwards, it's far more clinical, and you're actually in hospitals or meeting patients day
Can
to
you
day.
just describe what clinical versus non-clinical means?
Yeah, so clinical would be, as I say, so out on placement, you're shadowing, you're helping sometimes the junior doctors, if they want you to take blood or take a history, do an examination on a patient who's came in. You clerk the patient and then go and report to a senior doctor to
What
kind
does clerking mean?
so take a history or do an examination when a patient comes in or is new to a ward, to try and work out what's wrong with them, and then you go and talk with the senior doctor so they can give their opinion. Whereas before that, so in your non-clinical years, which are your first 2 years in Cardiff, it's far more lecture-based, so you're working on the theory behind disease processes, and you get communication skills teaching, you get skills teaching, so you learn how to do cannulas and take blood pressure, do CPR, all that jazz.
Okay, you say that the case bases change every 2 weeks.
Yes.
How do you get to know enough about each case in those 2 weeks? Do you get directed, or do you you work with a group of students? Is that right?
Yeah, so you have a set of learning outcomes with each case that sort of give a rough framework, and then you have a facilitator with each group who kind of make sure that you're not going too far off track, or directs you where you want to go, and is there if you've got any questions. And then the way at Cardiff they describe it as a spiral curriculum, so you'll cover, say, the heart in one of the cases. You'll see, heart attacks, you'll see myopathies.
What does myopathy mean?
So, like problems with the heart muscle.
Okay.
And then you come back to it in future years. So then you'll do a placement block. Say, for example, in an A&E where you'll see heart attacks for real. You'll see patients come in who have had heart attacks, and then it consolidates the knowledge that hopefully you've acquired in the case-based learning, and that's true for all the different aspects of the body.
So you revisit a particular area of the body over different years when you've got more knowledge.
Exactly, yeah. And hopefully you remember more and more each time.
Yes. Okay, thank you. So what would you feel, you've sort of said, but can you think of advantages and disadvantages of the case-based learning approach?
Yeah, I think it feels more real. Because we had histology lectures as well, and it can get quite dry when you don't really know what you're looking at or not sure why it's relevant. So it's not always as easy, I don't think, to maintain interests, or it doesn't consolidate the knowledge in your mind as well, I don't think. Whereas with the case-based learning, if you've got a case of a woman who has a heart attack, it's easier to remember, especially when you see patients like that in the wards or in GP surgeries as well.
So it becomes real from the very beginning, I guess.
Yeah, well, more real than I think just sitting in a lecture hall 9 to 5 would do.
So what would be the disadvantages, do you think, from that sort of approach?
I don't think you can cover everything in as much detail. So, because Cardiff, before I joined, used to be more lecture-based, and so they'd have two full days of dissection a week, whereas we only had one morning. So you just can't cover it in as much depth, I don't think. But I think for a lot of medicine these days, you don't need the niche scientific knowledge maybe as much as they used to teach. It's more important to know your communication skills and be able to communicate and elicit information from the patients, which I think we're probably better at these days than maybe medical students were in the past.
I think also from my perspective, as we said at the beginning, I think, or as you said, I think a lot of being a doctor is about learning and continuing to learn. And I guess my hope would be that case-based learning would encourage you to go away and learn self-directed learning. So you reflect on what you need to learn and learn more. Would you say that was true?
Yeah, definitely. Reality? I mean, that's the whole basis really, is that it's sort of on your shoulders far more to figure out areas where you're weak or where you're interested and look into them. And I mean, that's what I found, areas I'm interested in, research in much more depth, and then remember it far more easily.
And I guess again that means that sort of one of the attributes of being a doctor would be to be able to, and to be interested in learning, to definitely go ahead and follow up the learning when you see patients. How can students get more knowledge of universities? Medical courses?
Yeah, so look online, look at the kind of as they run things online, and then I think it's great to go and visit. Open days are a fantastic way to see the city as well, see the medical school, see where you'll be having lectures and going on placements. And it's useful to look into where their clinical placements are as well, because the medical school itself may be great, and be in the middle of a big city that you like, but maybe some clinical placements will be away in areas that you don't want to go to. So like for Cardiff medical students, most will do placements all over Wales. So they'll be in North Wales or right West Wales, which some may not want as much. Look a bit into that as well. But I think overall the experience will be fairly similar between universities, and it matters less than in other courses, I think.
I think in Cardiff, those who I've spoken to who do a lot of the course in North Wales or West Wales seem to really enjoy the experience.
Yeah, I've never done it, but I've had friends who have, and yeah, it's brilliant. I think it just gives you a different sort of patient you see and different style of learning that you don't get in the city.
Absolutely. Students would like to know about the interview process as well. It's changed from when you did it, but if you could briefly say what your interview was like, but then your knowledge of what the interviews are like now.
Yeah. So when I did it, it was different. So it was just one interview with 3 people, and they sort of ask you a range of questions. They're fairly standard, why Cardiff, why medicine? And I think you've read in the news recently that's interested you. Now they're what's called MMIs. I don't know what multiple mini interviews are there. So I think you have 7 to 10 stations, which are much shorter, 5 minutes long, and they've got a range of different things that you have to answer questions on. So one station will be how can you show empathy, one will be communication skills, are they? I'm not quite sure, but they vary uni to uni. But I think an important thing that I got wrong when I was first thinking of doing my interviews was I was trying to show all the knowledge I had and was too keen on to show that I was already in medical school, as it were. I already had knowledge, whereas I think it's important that you're not going in as a doctor. It's important to remember to show keenness and to show that you're really interested in it, but to accept that you don't know anything yet. You haven't been to any lectures, so you don't need to worry about asking questions. If they ask you any scientific questions, it's not think through the process rather than having to get to a right answer is more important, I think.
That's a good way to think about it. Anything else you'd like to say that might help someone thinking about doing medicine as a career?
Speak to medical students, speak to doctors. I think a lot still enjoy their job and wouldn't change things. Speak to anyone at current university, see if they enjoy it there. I think speak to people who've had the experience and they'll help you, and you might be able to point you in the right way for work experience and other things that will help you get an interview and help you get on the course.
And you'd recommend it?
Yeah, definitely.
Lovely. Okay, well, thank you very much, and I hope that's been helpful. Thank you.